everyone, and welcome to Mental Health for Working Parents, where we talk about various emotional demands of parenting without shame or stigma. And today I'm here with Anna Sladen. Thank you for coming.
Thank you so much for having me.
And we're going to talk about OCD and perinatal OCD as a part of that. And so Anna is a licensed clinical mental health counselor in the US in North Carolina. And please jump in and add to that. But in your practice, you do specialize in working with OCD generally, and specifically also you work with perinatal OCD.
Yeah, so I work with OCD and related disorders. The majority of my clients are experiencing OCD. And we treat OCD across the spectrum, so children, adolescents, and adults. And we do see clients who are experiencing perinatal OCD.
Okay. So you work with both children and the families, and you kind of author some coping strategies as well as treatment for OCD.
Absolutely.
Okay. Yeah. And I just kind of, just as a quick introduction for those who are going to be watching, because I think out of, all perinatal mood and anxiety disorders, which includes perinatal depression, anxiety, and OCD, and, psychosis and bipolar also as part of that. But I think OCD is something that I guess is a bit more confusing for people because there is still lack of information about it. There's kind of a lot of confusion with some of the symptoms. There's confusion around, OCD very often being confused with like anxiety, sometimes even ADHD, which I also, I don't know if it's something that has been your experience. So can you just generally talk about what is OCD and what are the main symptoms that, because this podcast is for parents can either see in themselves or their children, where they can actually think that it might be part of OCD?
Yeah, great question. And I'll just say for our audience, take everything that you've learned about OCD, especially if you've seen it on TV or in the media, and just throw it all out because it is likely very wrong. And that's one of the biggest problems for this condition is it's been popularized in a way that's just not authentic. And that gets in the way of getting help and recognizing it. So let's unpack that a little bit. What is OCD? Well, OCD stands for obsessive-compulsive disorder. And let's break that down. Let's double click on that a little bit more. So obsessive. So obsessions are unwanted, intrusive thoughts, images, or impulses, urges that when you experience them, they trigger a lot of distress. They're very uncomfortable. And I also want to highlight the word intrusive, right? Because that's a word we don't hear in common every day. And that is, you just can't get it out of your head. It is in there, whether you like it or not, and it makes you uncomfortable and you want it out, but there it is. Compulsions, that's that second part of OCD. They're behaviors that an individual might engage in to try and get rid of the obsessions that they're having and decrease that uncomfort that they're having, that distress. And in order to be diagnosed with this, there needs to be the presence of obsessions and compulsions, but they also need to be pretty time consuming, and they have to really start to demonstrate some interference in your life. I think a common phrase is people will say, I'm so OCD, and refer to that as like perfectionism or cleaning. And although those are elements of what someone who is experiencing OCD is experiencing, they're just a small corner of that. And using that phrase is part of why a lot of people just don't understand what OCD is. Yeah.
And can you just specifically talk about perinatal OCD? Because I think this is where what you've said even getting more confusing because of that kind of transition that parents are going through there. I think a lot of things are outside of normal. And, I think on the top of that, for example, starting experiencing intrusive thoughts, or, starting to have those kind of obsessive thoughts, that for a lot of parents I hear could be, I need to check if my baby is breathing, or, I, for example, need to check if the baby is gaining weight, or I constantly need to check if the baby is cold, hot, full, whatever this kind of constant need to check is. But it can be part of, I guess, normal part of parenting as well, because I think at some point all of us have some of level of obsessive thoughts, especially when it comes to parenting. So can you just kind of talk specifically about perinatal OCD?
Yeah. And I love the point that you made, in that everybody is checking their child from time to time. Everybody's worried about, is their child breathing? And that's a great thing to have. That is, our job as parents is to keep people, our children, safe. But what happens is these obsessions and the compulsions that come along with them, they get that time consuming and they begin to interfere in their life. And let me talk a little bit more about what that looks like. You gave some great examples around obsessive thoughts that are related to the safety of the baby. But for so many people who deal with perinatal OCD, they're also experiencing fear around themselves as a danger to the baby. They worry if they're constantly checking themselves. Am I feeling connected with my child? Am I feeling love? Can I tangibly feel that love? And if not, that must mean I'm a monster, and that I must be a danger to my child. And so I have worked with folks who have been afraid to hold their baby or be left alone with their baby, because they're afraid that if they're not constantly feeling love all the time, and they're constantly checking themselves for that, then that means that they're a risk for being a danger to that baby. And that's where you see this all or nothing thinking that shows up a lot with OCD, and that it can either be one way or the other. But so much of life is in that spectrum. And the reality is that although media, again, likes to portray, fertility, pregnancy, delivery, having a child as being something that is always going to feel like a blessing, that you will always love your child, that you will always love being a parent. The reality is no one is experiencing that, but there's such a stigma not to talk about the reality of fertility, pregnancy, delivery, parenting is tough. It is hard. And when we put that stigma on, what then happens is when parents don't experience that fairy tale experience, they're afraid to say, I need help, or I am experiencing something like OCD, where I'm afraid to hold my child. I'm afraid to be alone with them. I'm afraid they might die if I'm not constantly watching them. I'm afraid of other people. That when these fears pop up and they begin to get in the way of living that values-driven life that we're all pursuing, that it gets in the way of asking for help, because nobody wants to come into a therapist's office and say, I don't always feel like I love my baby, and I'm afraid that I might shake that baby. And what we tell clients, because so much of OCD is about those things that feel horrible to admit that you're having those thoughts, is OCD attacks your value system, and it is the fear of that thing happening. It's not the desire. The desire to do it is something you welcome them in. OCD and the fear of it is something where the thought makes you feel horrible. You don't want that. You go to lengths not to do that. But because OCD attacks your value system, if you value the safety of your child, if you value being a good parent, it makes it fair game for the OCD to attach to and say, well, okay, if you're valuing that, then the only way to be certain that you can accomplish the safety of the baby is to eliminate all risk, including yourself.
So it's this kind of huge internal conflict from one side between those two sides, and also this, that sense of isolation where a lot of parents would feel ashamed to share this as part of that stigma, where just we as a society don't really talk about challenges. And this is also something that I see a lot with anxiety and, in perinatal depression, that kind of shame associated with what can we share, and what kind of my experience, because the perception is that it is so bad, or it's so unique, or it's only I'm feeling that, or no one is going to understand, or, this is so abnormal that it really means that something is deeply wrong with me, then this is why only small percent, I think it's only 10% of parents who are struggling following birth, and even during the pregnancy, just overall in perinatal period, are going to get any kind of help, which is very, just kind of gives a context of how many people are going to struggle and be isolated because of that stigma and shame that you were mentioning.
Absolutely. One of the most painful demonstrations of it is what we call sexual OCD. And that is where the parent, and it's typically the mother, is afraid that they might sexually harm their child. And so they're constantly checking, am I aroused when I'm changing their diaper? What are my thoughts? The challenge with this is that's like telling someone not to think about a white elephant, right?
Yeah.
That's going to be all you can think about if that's what you're worried about. And so it's very difficult. And I have a lot of clients today who struggle with this, of saying, like, I'm deeply afraid of what it might mean if I am aroused by my child. What in reality, while they bring, they're experiencing a great deal of shame. And I often have clients say, please don't report me. I would never hurt my child. From my perspective, over 70% of the women that I work with have experienced or are experiencing that type of OCD. It's very common, but again, it feels so bad. There's so much shame. It's so against what people value in being a parent that it's so hard to ask permission to bring that in the room, right? To share that with other people, to be honest about their experience, that they often suffer in silence. And then they go to these links of, I can't be alone with my child. I can't take care of them. I can't cuddle them. I can't hug them. And those things are so very important in that child's development, that when that parent, again, typically the mother, is not able to connect with them, it's just such a devastating impact on the family.
Yeah. So as a way to kind of manage some of those things that they're experiencing, those parents can kind of either disattach because they wouldn't want to do harm, and they actually perceive those thoughts as something that's very real and it actually might happen. It's part of the reality. And then from the other side is kind of having that need to stop the thoughts, suppress it by saying, it's almost like thinking that there's some level of control. And I think this is, I want to ask you, about this challenge of working with intrusive thoughts, or just experiencing those intrusive thoughts, where I also, in my experience, a lot of parents who have those thoughts, they kind of start really, just cognitively stop them, by saying, I should be able to stop it. I should be able to control it. I should be able not to think about it, and again, by reinforcing those intrusions as well.
Well, Pickle, let's try a Pickle example that I give Pickle with my clients. What did you just think about?
Yeah, Pickle,
right? And I love to hear what people say in response to that. Some people think of the color green, or they think of a pickle, or they see a pickle jar. Did you have to stop and think about the word pickle? Did you have to spell it out in your mind, or did the thought just come up for you?
Just came up straight away.
Just came up straight away. And from now on, whenever you go to the grocery store and you pass by the aisle of pickles, who are you going to think about? Me.
Only you. Yes. Every time I have a pickle, I'll think of you.
You'll think of me, right? Because it's that easy. Our brain pulls up these thoughts immediately. And it's for our safety, right? Like if you were to go outside my office and you were to there was a rhinoceros out there and you were to get charged by the rhinoceros, you don't want to stop and say, it's approximately 1,000 pounds traveling you just need to get out of the way.
Yeah.
And so our brain is constantly serving us up these thoughts, whether they're helpful or not. And a psychologist friend of mine was sharing with me, we have over 6,000 thoughts in the course of the day.
Yeah. Yeah.
And we all have very similar thoughts. Everybody who was listening to this, and I was saying the word pickle, they were having some kind of pickle reaction. If we think about all the stimuli in our environment, we think about all the media we're exposed to, and we think about everything around us, right? Then for us to think that we have that much control over our thoughts and are therefore responsible for them, it's just not realistic, right?
Yeah.
You didn't come into this interview thinking, we're going to talk about pickles today, right? I did that.
Yeah. And I think this is something that, though, a lot of parents are trying to do, right? To kind of rationally, to understand, to, there's why is always the question that's being asked, why am I experiencing this? What's wrong with me? But there's this kind of need to rationalize, need to understand, as opposed to, because they don't have actually coping strategies to deal with that. So can you just talk a little bit, as opposed to kind of trying to rationalizing it, what are the ways once that something is not normal, for example, as a parent in that perinatal period, perhaps, what are the ways to get support? What are the ways to get some help?
Yeah, that's a great question. So when we look at how we treat this, we really focus on just getting to the point where we're not valuing all of our thoughts, because that's what really OCD is about. It's about overvaluing our thoughts, and instead getting to the point where we can just accept that sometimes we have thoughts and sometimes they're not great thoughts, but everybody experiences it. And to be able to accept that they'll be there. And then when we don't focus about it, they go away on their own instead of us having to do something. That's really ultimately the goal. But that is easier said than done. So we have a couple different treatments that we use, and the gold standard is exposure response prevention therapy. And what that's really about is around kind of breaking the habits that have been formed. So I have these thoughts, they make me uncomfortable, so now I don't hold my baby. And we break that habit and we say, well, let's make a new path. So we want to hold the baby. You're not a risk to the baby. So if you have those thoughts, what do you do instead? And so we work through that habitualization. We also break through avoidance, and we help to disconfirm their assumption that if they have hold the baby's in danger. And we break that and say, is the baby really in danger? What is the truth there? And so we break through that. And then we also address that life is not certain. And OCD says everything needs to be certain. We must, get to certain, because that feels safe. And so ERP really helps people get comfortable with the idea that sometimes we are uncertain about life, and that is okay. We can still handle it. We also do a lot of acceptance and commitment therapy, which is really around how do we have a lot of self-compassion for ourselves around what we're experiencing and live a values-driven life. What does that look like? How do we commit to that? And so there are, other ways in which we approach this. We do some CBT that's modified for OCD. We use some metacognitive therapy. But generally speaking, most of the therapists that clients would need to seek out would be using ERP for sure, and then ACT, the acceptance and commitment therapy.
Yeah. And, I just want to kind of reinforce that I think, and again, correct me, that the goal wouldn't be to just get rid of completely of those thoughts, because I just really want to normalize, that intrusive thoughts and obsessive thoughts are actually part, at some level, something that every parent experiences. Just yesterday, I was at the playground with my son, and it was just like a very nice moment. We were playing football, and then I had this image in my head that he would fall and he would really hurt himself, and it was really scary because it just came out of nowhere, and it completely kind of took me off guard, so that was that intrusive thought, and it's a scary repeated thought that comes out of nowhere, right? Because in that moment, everything was fine. We were completely safe. I was very happy. It was a very content moment, but then somehow it was this disruption that I think, I was able to notice, and I was able to ground myself. But I just really want to normalize that this is part of And it could be an indication, that perhaps like a lack of sleep, that perhaps I had too many things going on, that my nervous system wasn't able to digest or to integrate or to cope with whatever it was. But those thoughts are going to be part of some of the worries we have, or some of the fears we have as parents. So what would be kind of the goal of this treatment?
So very well said. And to really reinforce your point, everybody has these thoughts from time to time. We may not be talking about them, and sometimes the thoughts happen so quickly we don't even really notice them. But every person has picked up a knife at some point and thought, yeah, I could stab somebody with this.
Yeah.
Every person has looked at a shopping cart handle and been like, ugh, there is all manner of germs on that. The difference is where it becomes an actual mental health problem and causes impairment is when we see those thoughts and we say, I need to value those thoughts and I need to hold myself responsible for those thoughts. And that's where, getting to your point of, if all of the other parents on the playground are having the same thought that you had, but only one of them is saying, I need to take immediate action. What does it say about me as a parent? Then that person is experiencing OCD. It is not the thoughts that characterize the OCD. It is the amount of distress and the amount of impairment that their actions to reduce that cause.
So I think like the way to think it, is we were to kind of use a window of tolerance, it's if it's something that would really be so outpowering for me that, for example, I would just leave the playground, then I said I wouldn't go there tomorrow because this is something that might actually happen, that would be outside of my, I guess, normal behavior or, like things I would normally do, then perhaps this is like that indication that it could be something where I need different coping skills to be able to manage those thoughts.
Absolutely. And so much of it is around self-efficacy and self-compassion, that it's okay to have those thoughts. It doesn't make you any different than anybody else. And you can handle being uncomfortable from time to time. It doesn't mean that you're a bad person. It doesn't mean that you're broken. It just means that sometimes you have a thought that makes you uncomfortable. And that is part of being human.
Yeah. And I really, think that the skill that comes through therapy is kind of not to dismiss those thoughts by saying, they're not real. Nothing is real, they're just, and I would want to dismiss them. So I just want to completely get rid of them. And that polarity where, okay, this is just like something that's present. This is real. So I think the skill is actually to be able to stay in here and now and thinking, how can I support myself while that's what I'm feeling is very valid. It's important, and this is why I'm allowed to have support. I'm allowed to talk about this. And, as part of just getting help, I'm going to kind of give it significance as a way to get better, to get better, to manage it in a different way.
Yeah. Marina, one of the things that come up for me is this really great workbook that I do with clients, the mindfulness workbook for OCD. And it makes a lot of really valid points, but two that come to mind as I'm listening to what you're sharing is thoughts are not threats and emotions and feelings are not mandates to act. Sit with that idea of you can have a thought and it can be very uncomfortable, but it's not actually a threat to anyone. Nobody died from having a thought. And that our feelings, while valid and important, and that's that self-compassion part, they are not mandates to act. We don't have to do something in response to having a thought or a feeling. We can get grounded in that values-driven life of what do we care about, what's important to us, and how do we act in that way? Because we have the conscious ability to choose how we act. Even if our brain is making us uncomfortable, that doesn't mean we have to listen to it, because we are not our brain. We have a brain, we have a mind, but we are the observer of our mind and our brain. It's not who we are. And so we can elect to not pay a whole lot of attention to it when it tells us weird things or odd things or uncomfortable things.
Yeah. 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 And can you just talk a bit about what can parents see in their children's behavior when they can suspect that they also might be some of OCD tendencies, or where they, again, as parents, might need some support or coping strategies, but also as a way to help their children?
Absolutely. So research suggests that most cases of OCD show up in children between the ages of 8 and 12. And then again, in that later teen years to early adulthood years. Research also suggests that it's estimated that about 1 in 200 kids and teens will experience OCD in their life. So that's about 500,000 youth in the United States. And that's, if you think about like your average size elementary school, the IOCDF and the March and Benton produced research that suggested that means about 4 to 5 kids in your average size elementary school have OCD. They're experiencing that. So what does that look like to kids? Well, parents can be on the lookout for a lot of self-judgment and that self-punishment. They can demonstrate through that perfectionism. They might be needing to erase and rewrite things in their homework, or they may be very hard on themselves if they don't do just right in an exam or something like that. They might have problems in school, right? OCD is so consuming of your thoughts that it can be hard to pay attention in class. It can be very difficult to sit at a desk that you don't feel comfortable with where things are. And you may be preoccupied to want to move things and organize and arrange things. It can be hard to make friends with others because OCD forms this very strict structure of rules around you so that you feel safe and certain. And so it may be difficult to make friends or interact with peers because you're having to first and foremost abide by these really strict rules about how to live life.
And they would
go ahead.
Yeah. I was just going to say they would influence a lot of the relationships, they would really influence how you build connections, how you build relationships with friends at school,
Absolutely. And a big one is it shows up a lot in emotional experiences. So anger, frustration, tearfulness. And this is why for kids, especially Black males, they're often misdiagnosed as having a conduct disorder. In reality, they're dealing with that emotional experience of having OCD. And because, we don't know a lot about it, a lot of people don't, even medical providers are not really clear on what OCD is. It's often just kind of shoved off to the side as they don't know how to behave or they have a conduct disorder. But in reality, when you're having to live by these extremely strict rules, then it's very easy to feel angry and frustrated or overwhelmed when people aren't living by those rules and you feel
because your needs are not being met. Your needs are not being met consistently. So there is a huge deficiency of, there's this inability to self-regulate in a way where you can integrate all of the experience. So there is a huge deficiency that can create so many distortions, in how we perceive everything, perceive reality and what we're actually receiving. So yeah.
And I tell parents, it's having OCD that is not being properly treated and maintained is like being on fire. When you are on fire and you say to your peers, help me, I'm on fire, then we don't stigmatize that, right? But because OCD is invisible, oftentimes people don't know what they're looking for, or they're not empathetic to the fact that there is a physical, painful component to many people's experience of OCD. It feels like your brain is on fire. And when we couch it in that frame and we say, like, we've got to understand what your kid is going through. Like, they're not trying to be disobedient. They're not trying to be aggressive, but their brain feels like on fire. And how do we help them not feel that way? That workbook I showed you earlier referenced it as sometimes it feels like an ice pick in the brain. And it very much feels like that. And when you think about being in those age windows, 8 to 12, and then, that middle to older adolescent, and having to feel that kind of discomfort and sometimes physical pain, that's a lot for these people to carry. And so it makes sense then to see this anger and frustration and tearfulness. It's just how do we match them up to get them the help that they need, because it's very treatable.
Mm-hmm. And especially, in those years that are so fundamental in kind of establishing identity, into really navigating who we are, right? Because this is like the age where we make like a lot of decisions about our sense of self. So I think, what I see, and this is, I really agree with that, with like adult OCD and children OCD, because there's lack of understanding, there's lack of awareness. I think like a lot of parents still feel resistance to having a diagnosis, because there's part of that having that as something is wrong. We're going to go and we're going to be labeled, or our child is going to be labeled. And this is kind of, we don't want to be put in a box. And I just really want to say that I think there is all of that, right? Because a lot of diagnoses are being overused, and we have all of that where, everything becomes trauma, or a lot of things are labeled anxiety, or a lot of things are labeled ADHD, or a lot of things are labeled, there's that. But I do really think that when you actually know what you have, or what's the main challenge your child has, or you have, this is where you can actually get the tools that are going to be helpful specifically for you. And I think this is so important, just like to see that getting diagnosis is not part of this is what's going to be wrong, and this is what's going to define me or my child, but this is actually what I will know as a way to get that help that I need. And everyone, we all need help with something, right? Whether it's OCD or not, there are a lot of things that we as parents need extra help with. And
And a lot of parents, when they come to see me, they are afraid of what is this, and what does this mean for my child? The reality, though, is that OCD is very treatable. And when we look at, what it looks like in the long term when it's properly treated, and the child learns how to take care of themselves, that I think at the last OCD conference by the IOCDF, the International OCD Foundation, they shared with us that research is showing there's a higher percentage of individuals with OCD in Fortune 500 CEO roles, neurosurgeons, pro athletes, and A-list celebrity actors. And that the things that their brain is doing on overdrive that show up as OCD, when we teach them how to manage that and lean into the strengths that their brain is doing really well, then there's really no reason to see any limit. It is extremely possible to not just live with it, but to thrive. And I tell my clients, like, treatment is not about learning to wrestle a bear. It is about learning to ballroom dance with it. It is not at all the death sentence that I think a lot of popular sources talking about OCD suggest it is. It's very possible to live a very fulfilling life with it.
And I really love this message, because I think just generally when it comes to mental health, it's so important to see that this is all really about what do we need to learn to cope, to manage it better, and then just go on and achieve things that we want, live the life that we want, And I think this is especially for parents, because part of that modeling is also, okay, so this is what we have, and then what do we need to learn so we are able to get better, or so we're able to overcome it, or so we're able to help each other, and there are going to be so many stages in life where this is such an important skill to have. And I just love what you've said about kind of normalizing that it's not something that will put a full stop on your life, right? Or on your family dynamics. It's not something that you'll have to hold as this, like smoking a gun that or like a secret that you wouldn't want people to know, or you wouldn't talk to your friends about, where I think a lot of shame also comes from with just any perinatal conditions that a lot of parents are struggling with. And also what you said, that really all of that is common.
It is. And one of the things that, my practice, Greater Hope Counseling, really focuses on is that it's part of neurodiversity. It is not because you're a bad person. It is just because your brain is doing something that's a little bit different. And we have to learn how to help your brain get what it needs to thrive. You got to learn how to take care of yourself. A lot of it is brain hygiene. And then, how do we get you back into living that values-driven life? And it's extremely treatable, but here we focus a lot on celebrating neurodiversity and not really playing into those stigmas of this is the worst thing that can happen. It's because you're a bad person. None of that is true. And it's a great thing once you learn how to manage it and do lean into the wonderful things your brain is doing and manage the uncomfortable things that your brain is doing, which is the OCD. But it's not a bad thing to be neurodiverse. For those of us in that community, we would choose it. It's a beautiful thing. And so parents really, I would just encourage all parents to not see this as the end, but rather a new beginning of really understanding all the really wonderful things that are going to be possible for your child.
Yeah. And new ways to connect with each other, new ways to build connections. Yeah. Thank you so much for sharing some of that. And we are going to link, the website. We're going to link the manual, the workbook that you showed as well. And, hopefully for those of you who are watching and you might have some questions about perinatal OCD or OCD generally, or you might think that, your child or your children might have OCD, or just kind of generally have thoughts, reflections, just please comment. As I said, we're going to put your website. So please do contact Anna, and, let's normalize talking about mental health. And thank you again for sharing. It was really, it was an important conversation. And I hope the message that you are giving that, is really about, don't be ashamed, right? Don't put yourself in a box by thinking that this is what I have, is so powerful and so important. And I hope a lot of people will digest it and soak it in and will
absolutely
come out
thank
of
you
this
so
isolation
much for
and get help.
Yeah, thank you so much for having me on your show, and thank you for all that work that you're doing to help shed light on the ways in which parents can get help when needed, be encouraged, and really find community and support. So really value everything you and your folks are doing.